So medical marijuana has probably very little chance of getting an FDA approval. One, especially with natural plant products, it's very hard to standardize dosing and dosing preparation of the product. So that's something that is really difficult, and especially depending on how you're using it. So if you're using it via inhalation, there's so much variability between dose from how one person inhales versus another person inhales, how much is actually burn off during actually burning the plant. And it's a multitude of compounds and constituents. So, this is one of the things with medical marijuana is that, we oftentimes focus on the delta 9 THC, but there's a multitude of phytocannabinoids in the medical marijuana plant. So you've got cannabidiol, you've got various other different chemicals that are going to vary in concentration. So it's very hard to keep it, I would say it's very hard to keep it standardized. And the fact is that we don't necessarily, to administer it, it can be, there's so much variability between how you administer it. So you would have to find ways to standardize that, because it would be kind of an inaccurate science. And that's one of the hard things with medical cannabis. We know a lot about delta 9 THC, and we have products that are FDA approved that contain the active ingredient of medical marijuana, one of the active ingredients, and can use them for patients that are having appetite problems or wasting associated with cachexia and HIV. But it's standardized. It's one dose, a couple of different dosages within an oral formulation that went through the standard approval process. With medical cannabis, since there's such a variety of plants, strains, you'd have to find specifically one, and the FDA would have a very hard time really wanting to approve something that there is not consistency with, that you may deliver it through a means that may have consequences such as smoking, and the fact that it's still a Scheduled 1 substance, really until that is lifted, the FDA is probably not going to want to even step foot into that, or really can't, because it's basically deemed that it doesn't have therapeutic properties and that the risk outweigh any benefit of using it. Which there's of course lots of arguments about that, but until then that resolves, it's still going to be probably more of a state by state, and probably regulated how we see herbal products, regulated, things that haven't been given the FDA's stamp. It's more of kind of a dietary supplement or a supplemental therapy that hasn't been aggressively studied.